Hello once again. So today we're going to be doing another workshop. This time it's on spinal percussion therapy for the cranials and giving you some instructions on the use of the 3dEnergy gun for this particular procedure. So the steps we'll be taking, first of all, turn on your 3dEnergy gun with the power button, holding it till the display lights up. And setting your torque direction and speed that you're going to be using. Setting the impulse speed you'll be using, and it's, of course, particularly for cranials more than anywhere else, it's recommended to use lower settings initially and only increase them based on tolerance, feedback, and the preference of the person you're delivering this therapy to. So make your contact with the tip of the head on the initial cranial contact point. Then we're going to be gliding the tip around your predetermined route. So always keeping the gun perpendicular to the contact surface. So some don'ts with this particular type of therapy. Don't make contact before you start the impulses. So don't hold the gun on the contact point and then start the impulses. Don't change the speeds while maintaining contact. So take the gun away from your contact point, change the gears that you're using, and then go back to your contact where you've left off. Don't increase the forces with your own physical pressure, especially for cranials. It's very, very light pressure, just allowing the percussion to do the work. Don't overstimulate points. And particularly when you're using the 3dEnergy gun, you're going to find that it's very short time that's needed to stimulate these points to get the tenderness to diminish or even vanish. Obviously, don't apply percussion to the ear canals, to the eye sockets, to the lips or the nasal passages. And similarly, don't ignore any contraindications to delivering therapy to this particular person. And do not use a standard massage gun or massage gun head for these particular procedures. The 3dEnergy gun has been modified and designed specifically to be able to deliver this kind of therapy. So a disclaimer with all of these workshops, as you'll hear again and again. So I'm not making any medical diagnosis or recommendations made in these workshops. It's assumed that you have the necessary qualifications, skills, and indemnity to administer the treatments that are being demonstrated here. And if you do choose to administer or to receive any of the following therapies, it's your responsibility to determine the appropriateness of such care. So general principles: plan your preferred route to scan around the cranial surface. We're going to be demonstrating the route that I've developed over a period of experience. Using the triangular or the circular head attachment for the rotating head, depending on your preference for the requirements of this treatment. Always maintaining a very light pressure and allow the tip to slide and glide across the skin surface. You'll find that you become more and more proficient with this. The actual impulse and the rotation allows the gun to slide very easily. So it's recommended to seek feedback from the person you're delivering this to as to when small tender points are located. So some guidelines to following the following slides. So the route of scanning that I'm going to be demonstrating here is for example purposes. It's up to you if you wish to determine your own preferred route. The more specific points and paths that I'm showing are based on my own personal clinical experience. We'll be describing the vectors of rotation that I recommend. And obviously the images are 2D images, but they're trying to represent a three-dimensional treatment. So hopefully you can get the idea from the images. All of the slides that we're showing here are based on the right-sided patterns. And I'll be trying to post demonstration videos of all of these as soon as possible. So torque, clockwise or anti-clockwise, what are we using? So the general principle in most of these slides suggests the torque which will reverse the effects of clenching or bruxing, which I'll explain momentarily. So if you have an alternative method for differentially diagnosing your preferred contact point or the torque that you wish to use, please utilize those vectors. And then obviously for left-sided patterns, reverse the torque that's been described on these slides. So the most prevalent pattern that you're going to see in cranials is the result of tension or clenching or bruxism. So most of the time when we think of this disorder, we think of the jaw, but it's really an entirely global cranial disorder where the face tends to be shortening, the jaw tends to be clenching and closing. So as the jaw clenches, the cranials move forwards and downwards as well. So the pathway that we're going to be showing you today begins in the occiput. So don't forget, the occiput is a cranial bone. So we're going to be using anti-clockwise torque. So first path we're going to take is working our way across the lambdoid suture and back across the superior nuchal line, then across the inferior nuchal line. So beginning at lambda, using anti-clockwise torque, and here's our pathway. We're heading down the lambdoid suture, across the superior nuchal line, then back over the inferior nuchal line. Then from the lateral side, the right side, we'll be staying with anti-clockwise torque, working our way around this temporal suture, back across the temporalis, belly and origins, over the top of the sagittal suture, then down the coronal suture, and then doing a small circle of the sphenoid area. So heading above mastoid there, using our anti-clockwise torque still, sliding around our temporal suture, back across our temporalis, and then over the top of our sagittal suture, and then down our coronal suture, and doing a circle of the sphenoid. So then we're changing, so we're disconnected from our contact point, changing to clockwise torque, heading across the supraorbital region to the glabella, back across the frontalis region. So now we're in clockwise torque, heading across the supraorbital region to the glabella, back over the frontalis. Now we're down to the jaw. So again, clockwise torque, circling the TMJ, heading across our maxilla, coming back on the inferior angle of the maxilla to make sure we hit the pterygoids, and then scanning around the masseter muscle. So clockwise torque to open that TMJ, circling the TMJ, heading across our maxilla, back, making sure we don't miss the pterygoids, and then running around our masseter. So just to summarize that route that we've taken, we're starting at lambda, we're using anti-clockwise, scanning across the lambdoid suture, over the superior nuchal line, across the inferior nuchal line, heading around the temporal suture, back around the temporalis, over the top of the sagittal suture, down the coronal suture, circling the sphenoid, then we're changing to clockwise rotation, going around the supraorbital region to the glabella, heading over the frontalis, and then we're rotating around the TMJ, across the maxilla, back over the pterygoids, finishing up on the masseter muscle. So then obviously to go to the left side, we're going to reverse the rotations that we're using. So just some finishing notes: light pressure, lower settings, particularly initially when you're first doing this. Sliding, gliding across the skin surface, maintaining a perpendicular alignment of the gun to the contact, training your recipient to give feedback when you're crossing over points of tenderness. Then you can focus and concentrate on those areas. So DIY, do it yourself. You can follow the same process for delivering percussion therapy to your own cranials. So some other workshops that will be coming up in the future. We need to produce some video demonstrations of all of these preceding procedures, talking about what I call circling the sub, a variation of how to maximize your neurological impact on spinal work, demonstrating work on the coccyx, and then myofascial percussion therapy, how you can adapt the 3dEnergy gun for using myofascial therapies. So stay tuned, there's a lot to still come. Look forward to seeing you next time.